Maintaining balance.
Okay, you may start.
Good evening, doctor. So we are PMCH group 2 and our topic for today.
That's all the questions about the shall before. Yes, Dr. Ramirez. Yes. I was thinking because in the international customized MD program community, I think some of the professors are valuing
Good evening, doctor. So we are PMCH group 2 and the topic for today will be alternative and traditional medicine. So alternative medicine. Alternative medicine is a term that describes medical treatments that are used instead of the regular ones. So the first one to discuss will be acupuncture. So what is acupuncture actually? Acupuncture is a system of integrative medicine that involves pricking the skin or tissues with needles, used to alleviate pain or used to treat various physical, mental, and emotional conditions. It originated in ancient India. Now, acupuncture is used all over the Western world. So, what actually it does? Acupuncture points are believed to stimulate the central nervous system. This in turn releases chemicals into the muscles, spinal cord, and the brain. These biochemical changes may stimulate the body's natural healing abilities and promote physical and emotional well-being. So, for example, they help to release the endorphins, which are the natural painkillers for the body. So, there are some pros and cons for them. The pros are acupuncture provides pain relief. It is an all natural therapy. It is also scientifically proven. Acupuncture comes with no side effects and it makes a person feel more relaxed. But there are also cons on the same side. It can take time to work. It may not work in all the patients. Maybe the data will be selective. And also, a person may have to undergo lifestyle changes for it. The next is chiropractic. Chiropractic as profession began in the 1895 when its founder, Daniel David Palmer, adjusted the spine of a deaf janitor and claimed to restore his hearing. Spinal manipulation was not an unknown treatment in 1895, and Palmer never claimed to be the first one to use manipulation for the cure of the disease. The name comes from the Greek word meaning done by hand. The theory is that proper alignment of the body's musculoskeletal structure, particularly the spine, will enable the body to heal itself without surgery or medication. There are some benefits of chiropractic medicine. It improves the posture, help minimize migraines and neck-related headaches, reduces the pain and improves the range of motion of the spine and other joints, reduce symptoms of chronic conditions like osteoarthritis, treat minor neck or spine injuries, especially the whiplash. There are some negatives of the chiropractic medicine. Studies have released that the neck adjustment by a chiropractor may be linked to an increased risk of a stroke. There are some points to be remembered. We are not supposed to seek chiropractic adjustment if anybody has severe osteoporosis, numbness, tingling, loss of strength in an arm or leg, cancer in the spine, and increased risk of stroke or any known bone abnormality in the upper neck.
Herbal medicine. Herbal medicine has its own origin in ancient culture. It involves medicinal use of plant to treat disease and enhance general health and well-being. Herbs can interact with other pharmaceutical medications and should be taken with care. Always see your regular medical doctor about any health concern and tell them about herbal medicine that you are taking or willing to take. Health benefits of taking herbal medicine. Currently, herbs are applied to the treatment of chronic and acute conditions and various alignments and problems such as cardiovascular disease, prostate problems, depression, inflammation, and to boost the immune system. If used correctly, herbs can help treat a variety of conditions and in some cases may have fewer side effects than some conventional medications. Never assume that herbs are natural means they are 100% safe. Some herbs may be inappropriate for people with certain medical conditions. Disadvantage of herbal medicine. Herbal medications are not FDA approved. Herbal product can pose unexpected risk because many supplements contain some active ingredients that have strong effects in body. People taking medication with serious health issue, pregnant women, children should avoid herbal medicine. Traditional medicine. It is the sum total of knowledge, skill, and practices based on theories, beliefs, experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement of treatment of physical and mental illness. Chinese medicine. Traditional Chinese medicine is an alternative medical practice drawn from traditional medicine in China. It has been described as fraught with pseudoscience, with the majority of its treatment appearing to have no logical mechanism of action. Origin of Chinese medicine. The origin of Chinese medicine emerged in the Shamanistic era of Shang dynasty period. During this time, the religious deity was called Shangdi, who was believed to live in heaven in an imperial court accompanied by dead ancestors. Now some advantages of Chinese medicine. Decreased pain and inflammation, hormonal balance and improved fertility, reduces the body stress response, promotes body flexibility and balance. It aids in recovery process after an injury. It also helps improve blood pressure levels. Some disadvantages of Chinese medicine. Some Chinese herbal products have been contaminated with toxic compounds, heavy metal, pesticides, and microorganisms, and may have serious side effects. Manufacturing errors in which one herb is mistakenly replaced with another also have resulted in serious complications. Practitioners reported numerous adverse events arising from the application of acupuncture, including fainting, nausea, and vomiting, and increased pain, or the consumption of Chinese herbal medicines, including direct toxic effect and allergic reactions.
Ayurvedic medicine. Ayurveda is a natural system of medicine originated in India more than 3,000 years ago. The term Ayurveda is derived from a Sanskrit word Ayur, which means life, and Veda, which means science. So basically, it is a science of life. So Ayurveda encourages certain lifestyle interventions and natural therapies to regain a balance between body, mind, spirit, and the environment. It is a holistic system of medicine. Ayurveda treatment starts with an internal purification process, followed by a special diet, herbal remedies, massage therapy, yoga, and meditation. Why Ayurveda is used? The concept of universal interconnectedness, the body's constitution, and the life forces are the primary basis of Ayurvedic medicine. The goals of treatment aid the person by eliminating impurities, reducing the symptoms, increasing the resistance to disease, reducing the worry, and increasing harmony in life. Let's look at the pros and cons. So the pros of Ayurveda, it is safe and chemical free, which is less harmful, can be complete cured, improves health along with the disease, no operation needed for many of the diseases. There is seen effective cure. So the cons, few herbs may be toxic for people who are reactive to particular herbs. It requires great and experienced expertise. Risk of mixing various forms of medication on patients may develop serious reactions. Homeopathy. Homeopathic medicine is an alternative medical system that was developed more than 200 years ago. It is based on two unconventional theories. First is like cures like, and second is law of minimum dose. Basically, homeopathy is made from two words. Homeo means same and patho means pathology. Origin. So the alternative medical system of homeopathy was developed in Germany at the end of 18th century. Why homeopathy is used? Homeopathy is used to treat an extremely wide range of conditions, including physical conditions such as asthma, psychological conditions such as depression, including some chronic illness, which includes allergies, chronic fatigue syndrome, migraines, rheumatoid arthritis, irritable bowel syndrome, and premenstrual syndrome, which includes anxiety, mood disorders, etc. How is homeopathy treatment done? Homeopathic products are often made as sugar pellets to be placed under the tongue. They may also be in the other forms such as ointments, gels, drops, creams, and tablets. Main reason behind sugar pellets is that it can be easily edible by the children. Treatments are individualized or tailored to each person, varies from different person to different person symptoms. Pros and cons. So the pros, it improves immunity. It is really reliable. It is fast acting, effective for all age groups. In the cons we have, it has seen that it has limited role in emergency cases. Efficacies varies in different individuals. There is no fixed medicine for fixed disease or symptoms. Medicines are uncommonly available. Thank you.
Shell out.
Okay, thank you. That's alternative medicine. Actually, you are more experts with alternative medicine than I would ever be because your country is very rich in alternative medicine. Okay, so let's have the next.
Good evening, doctor. For group 27, we have the topic for today, surveillance, death, and birth certificate. So talking about surveillance data and strategy, death certificates were one of the earliest sources of public health surveillance data. While looking at the mortality data, every death certificate tells a different story. When viewed collectively, they uncover health disparities, inform policies and funding decisions, and also help improve the outbreak and disaster response efforts. Information from death certificates is increasingly used to address a national crisis, for example, drug poisoning, deaths, etc. Vital statistics include birth and death data. Both of these together are called as the vital statistics. They provide a very valuable picture of the nation's overall health. Mortality surveillance tracks the characteristics of those dying in the US, helps determine life expectancy, and also allows comparison of death trends with other countries. How people die provide insights into health threats encountered when they were living. So what is the purpose of death certification? It provides information and data on the circumstances of the death. It is also used for the following purposes, such as settlement of claims, inheritance, insurance benefits, proof of death, and prove citizenship in nations, authenticate one's identity and nationality, and also assist with obtaining government issued identity documents further. What is the importance of death registration? The death certificate can be used to determine the following three things: which medical conditions receive research and developmental funding, also to set public health goals, and to measure health status at the local, state, as well as at the international levels. This is just for example, the information on the death certificate, which is coded and classified using the classification of diseases, is entered into a whole database and consolidated by the statistics authority of every country. The consolidated mortality statistics is the foundation for the country's health policies, plans, and the programs. It informs the policymakers and planners on the leading causes of mortality, as well as its patterns and trends. Next presenter, please.
Importance of birth registration. Birth registrations is the process of recording a child's birth. It is a permanent and official record of a child's existence and provides legal recognition that child's identity. Next slide, please. A child's legal proof of identity. Without it, children are invisible to the governments, meaning they could miss out on their rights being protected and upheld, as well as essential services like healthcare and education. They cannot be protected if governments don't even know they exist. Not only is birth registration a fundamental human right, it also helps ensure the child's other rights that are upheld, like the rights to protection from violence and justice. Next slide, please. Confidentiality. Considering that a birth and a death certificate contains sensitive personal information, disclosure is generally prohibited unless it falls within the cases provided for in Section 13 of the DPA, Data Privacy Act, and the clause of Article 7 of the Child and Youth Welfare Code, specifically if processing is provided for by existing laws and regulations. Next slide, please. General instructions for completing birth and death certificates. Use of current form designated by the state. Complete each item following the specific instructions for that item. Make the entry legible. Do not use abbreviations except those recommended. Verify the informant the spelling of names. Refer problems not covered in these instructions to the State Office of Vital Statistics or to the local registrar. Obtain all signatures. Do not make alterations or erasures. Next slide, please. The medical part of the death certificate includes date and time pronounced dead, date and time of death, question on whether the case was referred to the medical examiner or coroner, cause of death section including cause of death, manner of death, tobacco use, and females' pregnancy status items. Injury items for cases involving injuries, certifier section with signatures. Next slide, please. This is an example of the cause of death certification in which we mention the cause of death and antecedent cause, underlying cause, and the manner of death. Next slide, please. The physician is to be familiar with state and local regulations on medical certifications for deaths, complete relevant portions of the death certificate, deliver the signed or electronically authenticated death certificate to the funeral director, assist the state or local registrar by answering inquiries prominently, deliver a supplemental report of cause of death to the State Vital Statistic Office. That's it. Thank you.
ceremony.
Thank you.
We
Let's proceed with the
invited our
next.
from batch 2006, our
Good afternoon, everyone. This is Group 4. Today, our topic is sexual transmitted infection. So, sexual transmitted infection, sexual transmitted disease or STDs or sexually transmitted infections are infections that pass from one person to another through sexual contact. The contact is usually vaginal, oral, or anal sex, but sometimes they can spread through other intimate physical contact. This is because some STDs like herpes and HPV are spread through skin to skin contact. So basically, there are 5 modes of transmission: vaginal sex, anal sex, oral sex, skin to skin contact, and infected mother to child. The symptoms of STD or STIs. The symptoms includes unusual discharge from the penis or vagina, sores or warts on the genital area, painful or frequent urination, itching and redness in the genital area, blisters or sores in or around the mouth, abnormal vagina odor, anal itching, soreness or bleeding, and abdominal pain. So let's start with the bacterial infection. Chlamydia. Chlamydia is more common sexual transmitted disease. It's caused by bacteria called Chlamydia trichomonas. It can affect both men and women. Women get chlamydia in the cervix, rectum, or throat. Men can get chlamydia in the urethra, inside the penis, rectum, or throat. So, and symptoms of chlamydia in men include discharge from your penis, burning sensation when urinating, burning or itching around or opening of your penis, pain and swelling in one or both the testicles, although this is less common. In women, abnormal vaginal discharge, which may have strong smell, during sensation when urination, pain during intercourse. Gonorrhea is an infection caused by sexual transmitted bacterium that infects both male and females. Gonorrhea is most common, affects the urethra, rectum, or throat. In females, gonorrhea can also infect the cervix. Gonorrhea is most common spread during vaginal, oral, or anal sex, but babies of infected mothers can be infected during childbirth. In babies, gonorrhea is most commonly affect the eye. The symptoms
Wala.
Who's
Kaya mamaya po uwi.
about to continue?
Turn my head.
What happened?
The territory the syphilis who don't get treatment will develop complication known as territory Philippine. Syphilis, sorry. So let's begin with the viral infection. Viral infection has been infected some microscopic germs which reproduce within the specific living cells. Virus may contain either RNA or DNA. Virus or obligate intracellular parasites are able to compete cells to make copies of themselves. Herpes simply includes virus 1 and virus 2, that is HSV1 and HSV2, also known by the names human. Both viruses may also be transmitted vertically during childbirth. However, the risk of transmission is minimal if the mother has no symptoms nor exposed blisters during delivery. The risk is considerably when the mother is infected with the virus for the first time during the latent pregnancy, reflecting high viral load. The genital warts or the human papillomavirus, that is HPV. HPV is most common newly diagnosed sexually transmitted infection in the United States. Besides youth and the gender, common risk factors of HPV infections and clinical sequence of the infections include high number of sexual partners, confections, chlamydia, trichomonas, or herpes simplex virus. Most HPV infections are cleared by the immune system, do not result in clinical complications. The HPV infections is very common. Sometimes HPV infections cause visible warts. HPV can live in vagina, vulva, cervix, anus, or penis. Sometimes the mouth or throat as well, and it spreads through direct skin-to-skin contact with a person infected with HPV. The hepatitis B, the caused by the hepatitis B virus. The symptoms include yellow skin, fever, loss of appetite, tiredness, and joint pain. Can cause severe liver damage and can be prevented with the vaccine. About 90% of adults who are infected with hepatitis will have no symptoms and will be cured automatically. The other 10% develop a chronic infection that cannot be cured. Now let's move on with the parasite STIs. Tuberculosis caused by the infected Purithris pubis. The symptoms included in this is itching in the genital region. Itching and rash. Trichomoniasis caused by parasitic protozoan Trichomonas vaginalis. Symptoms are genital discharge and itching. So, do all STIs show symptoms? No, some STIs like human papillomavirus and hepatitis B only show symptoms in small percentage of the people who become infected. Other like chlamydia, gonorrhea show symptoms like primarily in one sex, not the other. Even if an STI does not show symptoms, though it can still be transmitted to other person. So how do you know if you have an STI? So the only way to certain is to see a doctor if you show any of the symptoms, or if you have been exposed to any of these diseases, you should get yourself tested since many STIs are treatable and even curable. Why it's important to know the STI can cause a variety of symptoms from discomfort to permanent bodily damage to death. AIDS and STI is leading cause of death worldwide among those aged from 15 to 59. STI can be passed from pregnant mother to her child. More than 1 million sexually transmitted infections are occurred every day worldwide, the majority of which are asymptomatic. Each year, these are estimated 374 million new infections within one of 4 curable STIs: chlamydia, gonorrhea, syphilis, and trichomoniasis. More than 500 million people, 15 to 49 years, are estimated to have genital infections with herpes virus, HSV, or herpes. Human papillomavirus HPV is associated with the other cervical cancer deaths each. Why are STI an issue in humanitarian settings? In humanitarian settings, the risk of STI transmission may be due to increased sexual violence, the presence of workers in high mobility jobs, examples such as truck drivers, peacekeepers, transaction sex, alcoholic and drug use, lack of information, access to condoms, and high population density in camps. Controlling the spread. So there are behavioral change in complex and health screening treatments of STI remain weak. First, the behavioral change in complex due to the identical interventions that can reduce risk, sexual behavior changes, and brings to various complex challenges, which is include improving ability to recognize the symptoms of STI, increasing likelihood that will see or care encourage a sexual pattern to do so. The Human Health Service, the health service of screening and treatment of STI remain weak. Seeking people for the treatment, the poor quality for services, and so on. Now, what are the might be the regional challenges? So the slow policy adoption, the due to lack of resource infrastructures and finances, which may lead to hard to policy adoption. The next might be lack of knowledge. The sexual health is not taught in formal settings in most of the countries of the region, leading to poor knowledge of sexual and reproductive health among adults. For example, the study in Saudi Arabia showed that the major sources of information of STIs among respondents were internet, that 87%, books at 73%, TV and radios, which is 62%, friends, which is 55%, and newspapers and magazines were 50%. And family literacy, last but not least, 37%. The age restrictions, placing the conventional of widely accepted legal age of consent of 18 years on legal policies, prevents access to HIV testing among minors who are sexually active or at the risk of HIV infection. The misconception among both educated and uneducated population. For example, the study examined physicians' knowledge in India report that most of the half of the identified causing kissing as a mode of HIV transmission. The social cultural factor, which is influence that conservative views and social disapproval of the sexual health education signifies influence sexual health awareness and safe sex practice. The cost and the infrastructure, which is includes not using condoms, as refusal of higher condom prices and low risk of infections. The WHO response. The World Health Organization has framed certain agendas which are follows: developing global targets, norms, and standards for STI prevention, testing, and treatments, support the estimation and economic burden of STIs and strengthening of STI surveillance, global monitor of AMR to gonorrhea, and leading to the setting of global research agenda on STIs, including the development of diagnostic tests, vaccines, additional drugs of gonorrhea and syphilis. As a part of its mission, WHO supports countries to develop national strategic plans and guidelines, create an encouraging environment allowing individuals to discuss STIs, adopt safer sex practice, and seek treatments, scale up primary prevention, increase integration of STI services with primary health care services, increase accessibility of people-centered quality of STI care, facility adoption of point of care tests, enhance scale up health interventions of impact such as hepatitis B, HPV vaccination, syphilis screening in priority to population. The prevention of STI includes abstinence, stay with one uninfected partner, wait and test, get vaccinated, use condoms and dental dams considerably and correctly, don't drink alcohol exclusively or use drugs, communicate, consider with male circumcision, consider using PrEP, that is pre-exposure prophylaxis. The awareness of STS. Spread information regarding STIs, schools by organizing camps and workshops to educate students about STDs. Inform adolescents where and how to access HIV and other STS screening cares, where access is possible through mass media and digital media. In the health facilities, ensure the ability of HIV and STI diagnostic medications are available and that HIV and STI testings are provided district. Ensure the availability of condoms and promote their use. Encourage adolescents presenting for testing and care to refer the sexual partner and or offer them possibility of dispensing treatment to their sexual partners themselves. Distribute posters, flyers, brochures to the hospital clinics, pharmaceutists, and about the STDs and the transmission.
Please fix your audio.
Your concern.
Please fix your audio.
Are you able to hear me, Doc, now clearly?
Now better. Go ahead.
Okay. Clinical confidentiality policy. Oh my God. So we should keep everything discreet and don't let patients info that we should allow patient to feel secure about itself. So let's now know the correct and incorrect use of condom. So don'ts of the incorrect or do not do while using the condom. Reuse the condom. Use expired condoms. Unroll the condoms before putting it on the penis. Leave condoms in the hot or external cold places. Do not use oil-based products such as hand lotions or Vaselines as lubricants with latex condoms. Do not use your finger, scissors or teeth to open the wrapper. Use more than one. Do not use more than one condom at a time, including an internal and external condom. Do keep condoms in a cool and dry place. Put condom on erect and hard penis before genital contact. Hold the condom in the place at the base of the penis before withdrawing after the sex. Throw the condom away after it has been used in the trash. Use lubricant of water-based or silicone and apply as often as need to be reduced potential tears in the condom. The internal female condom, wore inside the vagina or anus, thicker, more than tear resistance, always latex free. Wider opening covers more of the external area. So get tested. For HIV, every age between 18 to 64 should get tested at least once. People who have occasionally exposure to HIV risk are at least should get tested once in a year. People who are at the high risk of HIV infection should get tested 3 to 6 months. For syphilis, if you are pregnant, get tested. Man who has sex with another man, that MSM, get tested. Have sex for drugs. The person who is having sex with drugs or money get tested. HIV or another STD, sex with someone who has tested positive for syphilis. Chlamydia and gonorrhea, age 24 or younger having sex, getting tested once every year. Age 25 or older are more than one sex partner or within a new sex pattern. Talk with the doctor about getting tested if you have sex with someone who tested positive for chlamydia or gonorrhea. The comprehensive sexuality education, which is part of WHO, which is first agenda to children and adolescents need to have a right to sexual education. Sexuality education does not harm children and adolescents. Well-designed and well-delivered sexuality education programs can do them good. Thank you. That's it.
Amen.
Okay,
So,
thank you.
nagdadala rin po talaga ng Wi-Fi. Yung parang
Okay, so you have seen alternative medicine, surveillance, and you will see surveillance birth certificate. It's important when you are looking at outcome of diseases. For example, we look at outcomes of COVID, outcomes of diseases in the background of your pandemic. And of course, we have your STI. Of course, that's always prevalent. And if we're not careful, it will further propagate. Okay. So next week, we will have your